So when it comes to cancers in women, I think the most common cancer what we are seeing nowadays is breast cancer, and that is followed by cervical cancer, cancer of the cervix. So if you look at the statistics between what was there 20 years before and now, I think the breast cancers have been rising, what we have seen in the present, and they have been alarmingly rising. And the most shocking thing is that these cancers are being detected at an earlier age than what was seen 20-25 years before, possibly because of a lot of issues pertaining to the daily routine things, neglecting certain important things which shouldn't have been. Since it's a lifestyle disease, most of this is linked to lifestyle changes. Like now, presently there have been increase in incidence of smoking, alcoholism, late marriages, late childbirths, and then obesity. So all these things are generally related to development of the breast cancers. When it comes to cervical cancer, I think this is the second most common cancer what we see in women, and this is most commonly seen in rural women. That is where the education levels and literacy levels are low. So why it affects people with lesser educational literacy is that this cancer, cervical cancer, what I mean, is linked to unhealthy sexual practices, unhealthy sexual hygiene, and getting married at an younger age and having multiple childbirths, which generally happens in people who are less educated. So people who are illiterate generally get married their children at a very early age, and they start having children at a very early age. And the sexual hygiene, the genital hygiene, is also very poor in this category of people. So we see higher number of women in the rural areas being affected with this cancer, and the most common cause for this cancer is human papilloma virus. That's a virus which generally is sexually transmitted from men, where it is asymptomatic and they generally don't have any symptoms. So these are the two common cancers what we see in women, and surprisingly or interestingly, these cancers can be cured, detected at a very early stage by very simple screening methods, or having a knowledge of these symptoms at an early stage, they can detect these cancers. Like when it comes to cervical cancer, the most common, the cheapest and the simplest screening test is a pap smear, where they take a little bit of the discharge or the fluid from the cervix and the proximal vagina, and then examine it under a microscope to see the cells which are, whether they are normal or not normal. The same way when it comes to breast cancer, the commonest screening we advise is a mammogram, or the simplest thing is to examine their own breasts every month, about 7 to 8 days after they complete their periods. So if they can follow these things, these cancers can be detected very early, and the cure rates are so high in this. With a very simple treatment, I think the cure rates can be almost near 90%.